And you are listening to On the Record with Tiffany. Today, I have a wonderful special guest, Dr. Richard Gibney, president of Empowered Kidney Care. Dr. Gibney, how are you doing today?
It's a great day. A typical Texas warm day, but that's typical for summer and all is well.
Oh, that's great. So, Dr. Gibney, I invited you on today to talk about kidney disease. We're finding that right now with COVID-19, it's very timely for us to discuss kidney disease because COVID-19 patients, many are being pushed into kidney disease. COVID is kind of acting as an AKI. For those of you who don't know, AKI is acute kidney injury. And so I thought, man, I need to bring on one of the best experts I know when it comes down to kidneys, and probably one of the most compassionate doctors in terms of patient empowerment, because, and that's you, buddy. In case you're thinking I'm talking about somebody else, I'm not. I'm talking about you. I thought we need to bring him on so he can kind of explain to our population what is happening right now with COVID-19 as it relates to kidney patients.
Yeah, I started a nephrology practice in Waco, Texas, and back in 1977. So for 43 years, I had the huge privilege and honor to take care of people here in Waco and the surrounding areas, and basically was very similar to what everybody else did as far as the traditional approach to medical care. In 2006, a dear friend of mine took me to IHI, Institute of Healthcare Improvement. Mm-hmm. And this was started about 30 years ago by Don Berwick, a pediatrician by background. And the whole point was the concept of continuous quality improvement. He and Maureen Bizignano and the whole family of IHI then taught our group how to do the science of continuous quality improvement. And from that, we then went on to patient-centered care, and our quality numbers dramatically improved. We went from being average to being the best in the country as far as quality. And in 2012, 6 years later, Britt Marie, the head nurse, and the first patient, Christian Farman, gave a talk at the IHI meeting in Orlando, Florida, the annual meeting. And it was showing you self-care in-center dialysis, which is basically like home therapy in-center, that the patients are taught how to build their own machines, and it's joyful, it's happy, there's tons of interaction where it's collaborative, and it was just like, whoa, compared to the assembly line approach, which is traditional, where it's just having the patient come in, sit down, be quiet, don't touch anything, and then as soon as they're finished, goodbye. This whole concept of self-care was quite extraordinary. And so they came the following week to Waco, Texas for a week and said, you're doing everything wrong. Which
I'm sure your staff and you wanted to hear that, huh?
Knew this ahead of time because they had first take the machine, and instead of having it turned away from the patient, have it turned toward the patient, and permission to touch the machine, as in build the machine with a protocol of similar to the protocol you'd have for home patients. And so we had 11 dialysis clinics with about 750 patients, and all the nurses were enthusiastic to begin. And so we were changing cultures from an assembly line, which is come in, sit down, be quiet, don't touch anything, goodbye, to a magnificent culture where the patients were given control. We were going to coach and train them how to build the machine, how to understand the workings of the machine, and have dignity and hope that their quality of life and that their health would dramatically improve. And this was just a magnificent process. The staff went through a great transformation, whereas they used to be worker bees, just running around like crazy doing all the work, and they became coaches and trainers, so doing a much more elegant process where they were coaching, training, teaching the patients how to do all these things, and it gave a great collaborative atmosphere in the unit. So huge improvement in culture. And the only thing we really tracked was we tracked mortality and hospitalization rate. And what we found were just stunning numbers. Basically, the mortality rate fell in half from 17% down to 7%. And the
Wow.
hospitalization rate fell in half from 1.7 hospitalizations per patient per year to 0.8. So we're like, whoa, do you think that if you would involve the patient in their care, they will do better? Yeah. Do you think that the person with the problem must be part of the solution? Yeah.
All of a sudden, yeah.
One approach that we thought was real good was they just come in, they had no involvement at all. And that basically, we had this thing about all the non-compliant patients, but the truth was we just had the wrong system in place. Patients were not non-compliant. The system was not the correct system, because how can you affect behavior if the patient's not part of the solution? They're the ones that really understand how to do things to make it work for them. You can't have just one system like an assembly line for 750 or 800 patients. You have to have a different system for each patient in a different way to adjust for their cultural needs, their personalities, their behavior. And so basically we went to a unit that we have no non-compliant patients. We have no bad patients, because we'd adjusted to meet the needs of the patients. And saying that, we really had great success. We started out, as you'd think, with the really good patients, or the people we perceived to be good, and just jumped at it and became very, very, very skilled and very quick at doing it.
So what were some of the things that you saw that happened with the patients themselves as you empowered them and gave them the opportunity to take back their healthcare experience instead of just sitting in a chair and being serviced? Now they're taking back that experience and the control of the experience. What did you see happen with the patients?
The changes were really stunning. That people, for example, people that before were very passive and did nothing suddenly became very involved in their care. They understood the dialysis prescription. They understood about cannulation. They understood about all the different aspects of dialysis. People with all of our barriers suddenly melted away. So we had a lady with severe rheumatoid arthritis that could build her machine despite the fact that her hands were very limited. We had people that were mentally slow that could learn how to pull their needles and build the machine just as good or better than other people. We had people with strokes that could do, again, parts of the building of the machine that improved with time. We had a patient that came and gave us a PowerPoint presentation on self-care or empowering patients. And I said, excuse me, I was making rounds in the unit. And I said, excuse me? And he said, I'm going to present a PowerPoint that I made up. So we just said we were having lunch that day. So it was just breathtaking that he got it. He sits there and gives his PowerPoint presentation. And that was the first time in my career that I had a patient present a PowerPoint on how to do dialysis correctly. We had Hurricane Harvey hit, a few years ago, and we had 50 patients come to Waco because it was dry. Right. And the 50 patients were just stunned, A, that our patients look healthy, and B, but they were building their own machines and they understood everything. They could take the Phoenix meter and check their conductivity without any problems. And again, that's the whole question of liability. This was the opposite. The patients made us better, more thoughtful, more careful, all the above. And also the blending of staff, that if you had a new staff member that you had in the unit that was learning how to build a machine, one of these more senior patients would come over and say, I see you're having trouble stringing the line. Let me show you how to do it correctly. But they were doing it in a spirit of love and caring. So the service to both staff and other patients went from being contentious and adversarial frequently in the old assembly line system to being one of love and caring and compassion, both from the patients and the staff side. So a dramatic improvement in quality and a dramatic improvement in the atmosphere of the dialysis unit.
Wow. Dr. Gibney, I want you to hold that thought, because we've got to go to pay a couple of bills, but I want to come back with you and talk some more about patient empowerment. If you are involved in the medical field, or if you are receiving medical treatment, then you want to come back and listen to what Dr. Gibney has to say about patient empowerment, because your health can be your responsibility, and it is your right to have good health. And Dr. Gibney is one of the good guys who can teach us exactly how to do that. You're listening to On the Record with Tiffany.